Okay, so thank you, Jess, and thank you for inviting Russ and I along today to talk about the work that we're doing in Armley. We work across 3 practices in Armley, so Armley Medical, Prior Review and Thompson surgeries. And those surgeries form part of the local care partnership. So again, working with third sector agencies, Leeds City Council, and various other agencies within the city. So I just wanted to share with you today really how we started with the support for men in the Armley area. So we were invited by the CCG to take part in population health management, looking at frailty specifically to start with. And we looked at, sorry, next slide, Jess, sorry, I will forget to say next slide, so you'll have to stop me from getting ahead of myself. Thank you. So we looked at data for Armley, looking at particularly frailty, but one of the things that we feel passionate about in Armley is mental frailty. I don't know if you know much about the Armley area of Leeds, but it is quite deprived, a lot of unemployment, a lot of drug and alcohol abuse, and a lot of men who are socially isolated and vulnerable, and therefore it's a very high suicide rate, and a lot of men who are, who have suicidal tendencies. So we looked at the demographic profile, so we established target areas, and we gathered feedback from patient-facing teams, looked at where there were needs for support. Now, as I mentioned, they wanted us to focus on frailty, and we were insisting on focusing on mental frailty. We did get a little bit of pushback on that at times to say, look, frailty is the focus across the city, and they meant elderly frailty. But like I say, we were passionate and we wanted to make sure that we targeted the right cohort in our area. We do a lot of work for elderly frail, and this demographic just weren't getting any support at all. So next slide, please, Jess. So once we'd gathered our data and established the cohort that we wanted to support, we set up some workshops, again involving third sector, and established that we needed somebody who could support those men, engage with men who were having these suicidal tendencies, and therefore we recruited a mental health support worker in Russ, who will do a little presentation after mine, and we raised awareness of the support worker within the LCP and the Leeds Mental Wellbeing Primary Care Team across the practices, and with our social prescribing teams, so that Russ gets referrals from lots of different sources. So we start to engage and listen to men and understand their strengths and assets, before Russ is able to provide that tailored mental health support. Next slide, please, Jess. So fortunately, at the population health management workshops, Jess came along and offered the support of Touchstone, whom she worked for at the time, and we employed Russ through Touchstone. So he works for Touchstone, but he's contracted to the practices. So he gets the right access, support and supervision from Touchstone, and they've been fantastic in supporting us with this piece of work. So we work with many local partners to enable our patients to build a sustainable package of support. So I know Russ will tell you himself, but he's done work at Armley Helping Hands, He's done a golf project and various other things which have really engaged men and helped them to, you know, come out of their shell and join in, make friends, etc. So Justine, who's our PCN manager, is also doing a piece of work around health inequalities, and in Armley this is certainly a health inequality, you know, looking after these guys with mental health issues. So again, Justine, it was on the call today, so if you do have any questions around that. So next slide please, Jess. So the intended outcomes were to reduce suicide rates, self-harm and isolation, and early outcomes have shown that, as well as a positive impact, there's a reduction in calls to crisis, 111 999, hospital admissions and GP appointments. Previously, you know, someone would come to see the GP. To be honest, the GP didn't really know what to do with them. You know, they'd sit and talk to them and listen and you know, maybe offer words of advice and perhaps medication, but you know, there was nothing really that they could point them in the right direction of. But now with Russ, it's certainly opened up avenues for referral onwards, and it's fantastic for the GPs. You know, they've got somewhere to refer and people don't go back. You know, Russ is then their point of contact, which is excellent. So Russ offers a person-centred coordinated care and is really responsive to their needs. And he's got social media, Twitter, Facebook. So we've maximised connection with the target population. Next slide, please. So we've the men we've reached as part of this work, we've seen themes gathered through patient feedback, and Russ completes outcome stars with the men he supports. So as I say, reduced reliance on GPs as their trusted support, creation of support groups and friends, reduced isolation through accompanying activities such as walking groups, golf groups, breakfast clubs, etc. and improve confidence and well-being, and you know, the best thing of all is experiencing fewer suicidal thoughts and self-harm because of that, which is excellent. Okay, thank you. Next slide, please. There is still unmet need in this area, and there's a lot of men out there needing support. So we have just recently employed another mental health support worker to increase capacity, and Matthew started last week, so he'll be working closely with Russ. We're also working with our social prescribing team, looking at similar need within the female population. And as I mentioned, Justine's our nominated health inequalities lead for the PCN. So do you have any questions for me based on that? Otherwise, I'll hand you over to Russ.
There you go.
So yeah, cool, let's start. So hi, so my name's Russ Giles and I'm the Men's Mental Health and Wellbeing Coach for the Armley Primary Care Network. And I'm just going to talk about how I've engaged with 188 men in 2021. So over the last nearly 2 years, I've been working with the Armley Primary Care Network and being tasked to look at how we can support adult males that struggle with mental frailty. As you all know, Armley has one of the highest suicide rates in Leeds for men aged between 40 and 50. My challenge was to look at how we could reduce this. So working alongside GPs in practices, I was able to receive tasks from GPs asking me to contact patients they had just seen. And I could then contact the patient and book a one-to-one appointment within 24 hours. Excuse me. These one-to-one appointments can last up to 1 hour, We can talk about whatever the service user patient wants to talk about, really. Not just focusing on the low mood, anxiety, depression, social isolation or suicidal ideation. And from that one-to-one, we create a person-centered plan. So just working with the tasks from the GPs works really well. But then I noticed that I was only working with guys that had took the step to talk to the GPs, and they'd actually gone and contacted the GPs to speak about the low mood. And I thought, how can I reach the guys that aren't taking that step? So I created this flyer, as you can see here, and I shared it all over Armley, community centres, shop windows, local social media sites. And from the flyer, I got quite a good response. I was receiving calls and messages from men, from family members of men, also local housing, social workers, and other third sector organisations. So working with a cohort of men aged 40 to 50 got me thinking about the referrals that I was getting coming in. And the range was a lot wider. The age range was a lot wider than between 40 and 50 years. So after a lot of thinking, I decided to drop that bracket, that cohort, and just work with adult males and allow any adult male who was registered with the 3 GPs to access the support from my service. So using my own work mobile, I was able to contact men, arrange one-to-one appointments. This also gave the patients my mobile number, and they were advised to save it in their phone book. This gave patients peace of mind and knowing they had direct number for the service. I was told they could contact it at any time. I'm constantly getting phone calls and text messages, WhatsApp messages throughout the day and the evening, but they know I'm not going to answer them if they're phoning me at 2 o'clock in the morning, for example. So lots of men that came to see me in the one-to-one sessions spoke about low mood, depression, brought on by unemployment, saying that they had nothing to get up for, and they felt socially isolated. After a few discussions with the patients, I decided to start a group called Wake Up Wednesday. So every Wednesday morning at 10 o'clock, we meet at Greg's on Armley Town Street, where I buy everyone who attends a hot drink and a breakfast roll before setting off to do that morning's chosen activities. Wake Up Wednesday activities consists of walks, fitness sessions, quizzes, games in the park, walking football, to name but a few. This social group setting allowed the men to make meaningful relationships with other service users, and it became a low-level peer support group. On average, about eight to 9 men attend the Wake Up Wednesday group every week. So the Wake Up Wednesday group only lasts for 2 hours every Wednesday morning, and I just thought, how can we expand that? So we set up a WhatsApp group, which initially was to get the information out about what local groups are available, what sports available, but it quite very quickly turned into a 24 hours a day chat social group for all the guys that were on it, which was absolutely brilliant because people are talking at 2 o'clock in the morning saying, I can't sleep, and other people are jumping on. So again, another peer support group, which was just so easy to set up, but the benefits that come out of it, massive. Where are we? All right, yes. So again, through the WhatsApp group, we were talking about what activities the guys want to do, rather than me saying, right, this week we're going to do this. It's like, what do you want to do? Where do you want to go? What do you want to see? Sort of empowering the service users and putting them in control. From this conversation and many others, our garden project was born. So collaborating with Armley Helping Hands and funded by the Wage Trust, our garden project is set up to build, talk and grow. So the service users are building raised beds in a garden for the Armley Helping Hands over 50 community to use. Staff are on hand to talk and give support, and we'll be growing salad vegetables alongside with other edible plants. This is also a great introduction to groups because it's outdoors and people can work with other people or by themselves at their own pace. So people that have been socially isolated for a while that are not ready to step into a room full of loud people that are confident. This is great sort of introduction to group. Another activity that I put on was try golf. Armley's got a beautiful 18-hole golf course, very hilly, but again, beautiful. So we decided to put on a 6-week try golf project. It basically consists of 4 one-hour lessons with a PGA qualified instructor and then 2 18-hole rounds of golf, all completely free to the service user. They've already got access to clubs and balls at the clubhouse. Once the 6-week project is finished, they get 10 discount cards so they can play a round of golf at any time for £5. Again, we set up a WhatsApp group, so once the project is finished, they can stay in contact with each other and arrange to play golf. 50% of the men that attended the 2 projects so far continue to play golf together on a weekly basis. A little fact about the Gotts Park golf course, 18 holes, it takes 10,000 steps to get around, and you burn roughly about 1,000 calories just by going and knocking a few balls around and chatting with your mates. So it's win-win. Okay, how long have we got? I don't know. So as you probably picked up, all my groups are focused on socialising. I found that when guys are out of the house and engaging in activities, they put aside the problems for just a few hours and enjoy themselves, talk to friends, and generally leave with a smile on the face. Everyone always says hello to everybody individually, and they always say goodbye to everyone individually, which gives it that community vibe. Then they go home and chat about it on the WhatsApp group. So because of the WhatsApp group has become full of chat, information that I'm trying to share kind of gets a bit lost. So I've been asked to create a Facebook page, which we now have, but it's a private men's Facebook page, so it's invite only. And it's been going over just a week, but we have 40 members on there already, where we can share activities, support available. So yeah, I think that's pretty much it. I did ask one of the doctors for some feedback, asking if any of the patients had give any feedback, and Dr. Gary Lees looked at me and he went, well, no, not really. And I just thought, oh, okay. And he said, because once you start working with them, we hardly ever see them. And I just thought, that's brilliant. I'll take that. Thank you. And this last slide here, this is just one of the gents that this is one of his comments that he put on a Facebook group when I asked for some feedback. I thought I'd leave you with that. So yeah, am I thinking about these activities preventing suicide? I was thinking about this, and I'd say no, but neither of the men that are attending the group. So on that note, I will say thank you, all done.